This is Dr. Caudle Miller, Dr. Miller's Guide to Neurology. We've been talking about headaches, and now we're going to talk broadly about symptomatic treatment for headaches. When I first went in practice, we had nothing. We had Tylenol, Advil, Fiorinal, Darvocet, Migraine. We had nothing to treat people with headaches. People back then just got stuck on narcotics, which was a disaster. You know, narcotics quit being effective after 4 to 6 weeks. You start getting tolerance and addiction, and then they don't work and you need more. So it was just a nightmare treating headaches back then. The first class of drugs that came out were the Triptans, and there's a whole nother video on Triptans, but when Imitrex came out, it was a lifesaver. Triptans work by binding to 2 serotonin receptors in the brain, and this leads to vasoconstriction of the cranial arteries. When you have a migraine, if you remember, you get constriction, then vasodilatation back to normal, then extreme vasodilatation. Triptans constrict that. So you have to be careful, don't use them in heart disease, people that have had stroke or family history of stroke. There's a bunch of different ones, and we'll talk about these in the Triptan video, but you've got Imitrex, Maxalt, Relpax, Frova, Emerge, and Axert. You know, like the short-acting ones, you know, we use symptomatically, and the great thing about those, you know, the Imitrex, Maxalt, Relpax, Zomig, and Axert, you can use them, repeat it in 2 hours. If it doesn't work, try a different one. So if Imitrex doesn't work, try Maxalt. When you got the long-acting ones, Emerge and Frova, that you can actually take one twice a day for 3 days if people have status migraine or menstrual migraine. You know, menstrual migraine's tough to treat, and symptomatically we'll often use some of these long-acting triptans twice a day, you know, with anaprox. Another class of drug we use symptomatically for years are ergotamines. Cafragot was the one we had years ago. It's off the market. Really, the only one we really have now we can functionally use is Triptans nasal spray, and it's really worth a try if they fail triptans and other drugs. A 1.4 milligram dose spray in each nostril, and you can repeat it in an hour. It's another great choice, different class of drugs. If it doesn't work, you can try something else. We still have DHE 45, which we use some emergently in the emergency room. You know, you can give 1 milligram every 8 hours for 3 days. Migraine nose spray is hard to get, but another nose spray worth a try. A third class of drugs we use symptomatically is NSAIDs. We have a lot of people that use NSAIDs. You know, Advil. Aleve seems to work a little better than Advil, but a lot of people love Advil. Cambia is one that sort of surprises me. The Cambia crystals, a lot of patients use it for their symptomatic relief. Why it works better than, you know, Clinaril or diclofenac, I do not know. And then you got the Gepants, the calcitonin gene-related peptide antagonists, or the Gepants. And they're just the newest class of drugs for symptomatic treatment. Qulipta and Nurtec, just great choices. Then you've got Zavrek, which is the new nasal formulation of Nurtec. So you've got these things you can try. So if triptans don't work, try one of these Gepants. Qulipta is 60 milligrams once daily. You know, it's going to work great. Not work at all. Zyrtec, 75 milligrams, works great. Doesn't work at all. Try something different. And then the nasal spray. Ubrevely, another great symptomatic drug, 50 to 100 milligrams. It's another one of the Gepants, up to 200 milligrams. You know, it's interesting, we all have our own biases. Nurtec and Ubrevely are what we use in this particular class of drugs. And there's a whole separate video on the Gepants. And then the Ditans is the newest class with just one, a Ravo and 50 to 100 milligram tablets. So once again, another class of drugs you use. Maximum dose, you know, 200 milligrams, but you try it if nothing else works. It's one thing I love about all these different classes of drugs. So try triptan. If it doesn't work, you know, try one of these others and just go down the list. The final thing we talk about is Botox, and we're going to do a whole video on Botox. But Botox we use for chronic migraine headaches. People have more than 15 headaches a month for 3 months, and it's just been a miracle. When it first came out, I wasn't real sure if I was going to use it, and had a little aversion to it because of cosmetic Botox, which I believe in. If cosmetic Botox is done in the right way, it can be very helpful. But Botox is just a great treatment. We're going to hold another video on Botox for headaches. So how would I treat someone symptomatically? Well, first thing I would look first at giving them a triptan. Maxalt or Imitrex or a long-acting triptan. You got to realize a lot of these, like Relpax and Zomig and Emerge and Frova, sometimes you just can't get them. Axert, you just cannot get them. We've done a whole couple of years where we couldn't get Frova. But I would try a triptan first, you know, and you know, add a triptan an anti-inflammatory to a triptan. A big study with Zomig with a leave. It worked like 15% better. So almost all the triptans, I'll give them 2 leave or 2.5 leave or Anaprox. And then, you know, if the triptans don't work, you know, try one of the Gepants. We like Nurtec and Ubrevely the best. And this new nasal spray, Zavrek, worth a try. If those don't work, then try Ravo. So you got some great things to try. So that's symptomatic treatment of migraine in a nutshell. Each class we'll talk about later in individual videos. So subscribe to my channel, like it, and make any comments. More later.